Well, now we're debating death. How much death is acceptable? Nobody's going to say that some death is acceptable. So they say zero is not a goal. Zero cannot be the goal. It's not even reasonable, let alone possible. So, then we get these programs like zero suicide. Zero suicide is not a reasonable goal. Stop saying that. Stop putting artificial, unattainable goals in people's consciousness. It's not good for anyone.
Welcome to the Reality Therapy Podcast, where the truth will set you free.
Welcome. I'm here today with Jake Wiskerchen, a licensed marriage and family therapist. So welcome, Jake.
Hello, Ryan. Nice to see you in person. We met on the X's, on the Twitters.
Yes, indeed. So tell us a little bit about yourself, your background, your bio. How did you get into therapy? What motivated you to go that route?
Geez, a series of false start careers, face planted into human services. I don't know. So maybe some context. I'm 46 now. We're recording this in 2025. And so I'm 46 years old, and I didn't really start on this adventure until about 15 years ago. My undergrad is in journalism, and I had a couple of different major switches there. So I started out as a chemical engineering major, and then I went to, that sucked because I didn't like math, or math didn't like me, or the maths, plural. And then I went into logistics because somebody told me that paid well, and that was just a different kind of math that I didn't like. And along the way, I realized that in my student development stuff and my participation on campus, I was like, I like people. I like event planning. We should do something. So I flipped through the course catalog and landed on public relations, which turns out is not anything to do with the public and everything to do with writing. Fortunately, I was a good writer. So I ended up in the journalism school, graduated 5.5 years from undergrad. And the post 9/11 economy wasn't super friendly. So I embarked on the series of false start careers I mentioned. I still wanted to go into doing something with people, event planning or whatnot. And that just wasn't going to be had in 2002. So I did a bunch of different things, from banking to restaurant, food service stuff, private security, dabbled into law enforcement. I coached high school track. I got a substitute teaching license. And eventually along the way, I found myself re-enrolling in grad school for college student administration, college student leadership, that kind of thing. And I ended up with an educational leadership master's degree, graduated in 2008, another depressed economy, couldn't find jobs. So ended up at Lake Tahoe at an institution that wasn't a good fit. And somewhere along the way, I was like, I still like people. I want to work at, with these folks. And during my first grad program, I met a guy who became a very, very good friend of mine and a mentor to this day, Christian Conti. And Christian Conti's name I drop as often as possible because he's been such a big influence in my life, and his work is very, very good. He's got a book called Walking Through Anger that I recommend to everybody, and he's got a phenomenal YouTube channel. But Christian reached out and he says, why don't you come work for me doing in-home paratherapy, essentially paraprofessional counseling in homes with children and some adults. And we call that PSR, BST, work psychosocial rehabilitation, basic skills training. So I ended up working for him at his agency where he was a clinical director. And then I was in, like, I love the counseling thing. So I re-enrolled in the grad program for counseling, graduated in 2011, licensed in 2012 for my internship. And then 2 years later, I was a real therapist in 2014. 2015, I opened Zephyr Wellness with a couple of colleagues, and that's the agency that I own and operate here in Northern Nevada. So we do outpatient counseling here, and got about 20 people working for us, and it's we're coming up on our 10th anniversary of Zephyr. So, a lot of water under the bridge there, and I blew through a whole bunch of stuff, but essentially I was driven to help human beings, and I thought that was going to take the form of education, which therapy often is, but also doing stuff with providing fun for people and in an event type setting. I DJ'd a lot and threw a lot of parties and planned weddings and that kind of thing. But here it is, I'm doing this, and it turns out this is all rolled into one. When you're working with people, you're invariably going to touch them in a way that improves their life through health, happiness, higher functioning, enjoyment. And that's what we get to do here, whether it's publishing content or education and training or actual deep psychotherapy to help people discover the depth of who they are. I'm basically doing it now, and I love it, and I love the freedom that we get to do in this profession. I didn't know what I was doing. I followed Dr. Conti's recommendation, or Christian's recommendation, to enroll in the MFT program at the University of Nevada. The dynamics back then were such that in Nevada, if you were a marriage and family therapist versus a professional counselor, and here we call them CPCs, clinical professional counselors, or wherever else they're LPCs. The difference was that MFTs could treat and diagnose essentially the whole spectrum of disorders except for psychotic disorders. CPCs could not treat couples and families, so they were limited by statute. And eventually I found myself, I raged against a whole bunch of things, and I like tackling systemic problems. So I found myself on my licensing board at one point, and I actually helped rewrite that law to bring parity to the professional counselors so they could treat couples and families, because everywhere else in America they're allowed to except for Nevada. So at the time, I think it was just the advice of the professors who said, hey, take this program, not the other one, because you'll be able to do more with it. And now we can treat psychotic disorders. We can diagnose and treat psychotic disorders. Everybody in the state can treat couples and families. And that was much to the chagrin of a lot of the MFTs here who thought that they had the market cornered on couple and family treatment or some such thing. So that was pretty bristly at that point in my life. It was 2016 to 2019 when I was with the board reworking a lot of that stuff. So it wasn't out of some noble desire to learn systems or anything, which I did along the way. It was more of, I think, people looking out for my best interest, saying, hey, get this licensure because it opens up more doors, which if you know anything about the East Coast of the country, it's actually the opposite. The social workers have the stranglehold on who can do what in the eastern part of the United States, and in the West, it's the MFTs. So the weird political turf warring that goes on in our profession is something that I still can't wrap my head around. It's like, is there not enough hurt to go around? We have to stab and knife each other. Why can't we just elevate the whole profession? I don't
Yeah, I wondered
that.
if you could go into that little turf war. That's something that I didn't realize was a thing until I got into grad school, and it was like, oh no, we're counselors. We're not psychologists. We're not social workers, and there's very clear demarcated boundaries and almost a little bit of antagonism between the different fields.
Yeah, I wouldn't say there's a little. I think there's a lot of antagonism among the fields. The backstory, I can only speak for Nevada, and then I can generalize to what goes on nationally. But for Nevada, the OGs were the psychologists. They were around in like 1959 or something. I think they got their licensure. And then the marriage and family therapist came along in 1973. And then, so in Nevada revised statutes, there's chapters. 641 is psychologist, 641A is marriage and family therapist, 641B is the social workers. That was 1987. 641A is also the professional counselors, and they were added in 2007. And alongside there's drug and alcohol counselors. That's 641C. They came around in 1999. By the time that everybody had stacked in, there was this built-in hierarchy of who could do what and who had first rights and all that stuff. So I would imagine the same type of thing occurs nationally. The first to be licensed and vetted by the state is the one who's going to call the shots, essentially. And when you believe either rationally or irrationally that your professional existence is threatened by the emergence of a new type of licensee, you're going to do what you can to make sure that you stay in business. Now, what we've obviously known over the last 15 years or so, it's certainly in the last 5, is that this explosion of, well, yeah, it's an explosion of mental illness, but it's also an explosion of demand for treatment. Nobody's running out of work. And I can comfortably say that in my state, but I think I can also comfortably say it in most other states where almost everybody encounters a wait list when they call. You don't encounter a wait list at Zephyr Wellness because we operate differently. But I think that's the center of the turf warring, is that there's the emergence of who was first, and the MDs really precede everybody. Although if we go way, way back, we had the barber doctors who were the original PhDs before the MD even became a thing. So not to get too historical, but the idea is that first on the block rules the block. Now, statutorily, depending on what your state statutes say, certain licensees are granted different authorities. So in Nevada, our psychologists are the only ones who can administer what are called psychometric testing instruments, which means they are the ones who can do the battery of assessments to ascertain through all their paperwork what it is that you're dealing with. They can do motor skill functions, they can do IQ tests, they can do all the sorts of stuff. The rest of us are prohibited by law. Now, it doesn't matter what my training is. I could go to the Pearson Institute and get trained in all those same, whatever they're called, the tests or the instruments or the assessments. But Nevada won't let me execute them. And that's because the psychologist's lobby has essentially told the legislature, hey, we're the only ones who are qualified to do this. Now, it doesn't matter how much extra training somebody has from Ohio, who may be a professional counselor or whatever, and maybe that's part of their curriculum. Nevada says no. So there's that too. And that's exactly what happened to our poor professional counselors when they emerged onto the scene in 2007. The legislature stuffed them under the Marriage and Family Therapy Board. Marriage and family therapists took umbrage to that, and that's why they're called CPCs, not LPCs. It's just another little thumb in the back. And they said, all right, you can exist, but you can't treat couples and family. That's exclusively for us. Well, fast forward to 2019, and Nevada sucks at everything you don't want to suck at. We're dead last in everything, including mental and behavioral health care, especially for children. And children are part of families. And lo and behold, of the 50 states in the United States, 49 of them allow their professional counselors to treat couples and families. Where does Nevada rank? Last. So it seemed like common sense to allow those people to do what they can do literally everywhere else, while also removing this metaphorical closed for business sign that was hanging on our border to anybody who moved into the state. So we did that. Unfortunately, didn't move the needle. But I think that's those two things. The emergence of new professionals into the community perceivably threatens the existence of the existing ones. And also, who is statutorily allowed to do certain things under the scope of practice. And now, of course, we see things like community healthcare workers and peer support specialists and all sorts of subclinical, I guess, regulated professions. And I've seen and read some disparaging remarks about those individuals too. Not to mention the coaches, right? the ones that the life coaches that we all are supposed to spit on and look askance upon. And it's like, yeah, well, I don't know. Humanity's been healing itself for like 40,000 years since this iteration of sapien has been walking the earth. I don't know that we should take ourselves so seriously that we just, pull the rug out from under each other whenever we get the chance. Maybe we just let people continue healing each other.
Yeah, I mean, I've done some life coaching for addiction clients, and also PRSS, which is peer support, also for addiction clients. And the level of training is extremely small. Like one of them was a 3-day training course. I guess there's kind of a trade-off where you're putting people out there who have less training, but you're also able to put more people out there. How do you weigh that trade-off?
I think the pendulum has swung too far anyway. I think we went from nobody talks about mental illness to everybody needs a therapist in way too short of a span. That's become a detriment. Both of those ends of the continuum are inappropriate. You should talk about what you're struggling with, and not everybody needs a therapist. I'm going to borrow from my friend Stephanie Wynn, who is an MFT up in Oregon, who has another phenomenal podcast called You Must Be Some Kind of Therapist, and you can find her at sometherapist.com. And she says there's a very stark difference between therapy and consultation. Therapy is, and I agree with this, therapy is still under the medical model. You have a problem, and then you ask what the goal is, which is usually to solve the problem, and then you structure some objectives to that goal, and then we do interventions. And when you're done meeting the goal, you're discharged, because by definition, you would no longer meet criteria for whatever the diagnosis is that you're suffering. So when you no longer meet criteria, you're no longer under the medical model, and you go bye-bye, just the same as we would in dentistry or physical therapy or medicine or pediatrics or any other medical profession. So in consultation, however, I can take your money just to talk to you and give you some feedback. That's the free market in operation, right? If somebody thinks that I'm awesome and my insights are worth paying for, they can pay me for those insights. We see it on Substack, we see it on YouTube, we see it on X. Maybe people subscribe all the time and pay $5 a month to hear what somebody has to say behind the paywall. But journalism has been doing it forever. So I don't think that's necessarily a bad thing. I think life coaching and consultation are useful, worthwhile endeavors. What the rub is the perception of whether or not they're quote unquote vetted by some neutral third party. And that third party often is the state. So the government steps in and says, here's our minimum standard. If you meet this minimum standard, we will bless you with a credential that says that we've stamped you as valid and whatnot, and you maintain your continuing education and pay your fees. And we'll say that you are certified by the state of wherever to meet minimum competence. Well, that's cool, but I don't know what that means to anybody outside of, say, the insurance market. Insurance wants to know that the state, which apparently is trustworthy, has vetted us properly. So peer support specialists fall into that category. They're now credentialed and vetted to a minimum set of competences, and now they can bill insurance like Medicaid. I don't know that there's commercial insurances that pay for peer support. There might be. Commercial insurance does not pay for psychosocial rehabilitation or basic skills training, for example. They often don't pay for case management because they have it in-house. But Medicaid will. So Medicaid at a state level will pay for those services. And Medicaid, being the state, wants to know that the state also authorized you at a minimum competence with a background check that you're not going to go out and harm people. Well, that's cool, but I would like a mechanism to differentiate among elite, good, fair, and poor, not just minimum. So if we can figure out a way to elevate the profession broadly and capture the paraprofessionals to the maxi professionals or whatever, then, maybe we have a star rating system or something like that. Then we can really ascertain who's being effectual in a positive way rather than just billing for the sake of keeping somebody on the calendar. So I think that's the rub. It's up to the consumer to decide, do you want a licensed marriage and family therapist? Does that mean something to you because the state of Nevada has given me the blessing from on high? Or would you rather go hire somebody with 3 million followers on Instagram because what they say is just some really cool stuff, which is totally valid, and they might be more effective than I am? I don't know, but I'm not going to have an ego about it. I think that it takes all stripes to help make the world go around. So, and even if it doesn't, we have them all. So we might as well embrace it.
Yeah. I mean, you talked about like the kind of this minimum threshold to qualify as being able to help, whether it's a marriage and family or a licensed professional counselor or drug counselor, what have you. There's this minimum threshold. That really made a lot of sense to me before going to grad school. And now I have a lot of questions about what that minimum threshold really is. It seems like we're not doing a very good job, in my opinion, of training counselors to actually counsel. I'm wondering what your opinion on that is, or what you've seen in people coming out of grad schools recently.
The floor has dropped for sure. Like, no doubt in my mind. We at Zephyr for the last decade have hosted practicum students in undergrad and graduate school, chewing through their hours so they can graduate. So one of the proudest things I've done as a professional is to host and mentor these grad students into the career, take them from newbie to fledgling to fully licensed. And what I've seen over time is it's just a really sad erosion of what basic concept of mental health looks like. Like, I'm not going to say that everybody falls into this bucket. Okay. So there's my disclaimer. It's not all, right? But the overwhelming majority seem to be more concerned with niceties than healing. And so what we've lost is the ability to be confrontational with people who have ailments and actually hold a mirror up to them, because we're more concerned about pain and pain avoidance without any attention to the idea that going into disequilibrium is uncomfortable and is also required for growth. We're more interested in keeping people in their equilibrium because we don't want to, quote unquote, cause more harm by inflicting, quote unquote, pain, which then, I keep doing the air quotes for the listening audience if you're not watching on video, but like the quote unquote pain caused by the disequilibrium into which we'd push them if we could challenge their beliefs and their ideas is tantamount to harm, which tantamount to abuse, and therefore you're going to get your license revoked. And that's literally the logic of these folks coming out of grad schools. They're just skittish and timid. Nobody wants to take a swing at saying, hey, maybe what you're doing is not working for you anymore. Like, we don't possess that language. We're tap dancing around niceties. And I believe, you got a book behind you called The Woke Mind, which I could probably take a guess at the contents of. I think I understand that postmodern deconstructionism has resulted in this degradation of the profession. And what I mean when I say postmodern deconstructionism is postmodernism is the idea that nothing is real. Everything is a construct of a construct. We make up our own belief systems and values as we go along, and they're not rooted in anything, and there is no truth. Okay. Well, that's a nice thought experiment for somebody who's stuck in binary thinking, because we can dislodge them from the black and white and say, hey, look at all the gray. But you don't live there. Eventually, you have to establish some standard for yourself, and that becomes your new thesis. And this is like Hegel stuff, like, thesis, antithesis, synthesis, right? And then the synthesis becomes the new thesis, and it spins off. And anybody who studies this should know. I don't even think we're teaching that anymore, because every time I ask somebody about systemic theory, they just look at me like I have a hole in my head. And this includes the marriage and family people. So we don't have a market cornered on systems. But the point is that this has now been put into policy on many levels. And at minimum, it's an encouragement. So I look at like the marriage and family therapy. The American Association for Marriage and Family Therapy came out with a 26-page guidelines on affirming care. Late 2021, it was written. It was actually released in early 2022. 26 pages. Well, the entire ethics code for marriage and family therapists is 11 pages. And all that's in that 26-page guidelines on affirming care is a bunch of postmodern deconstructionism. Deconstructionism, in conjunction with the postmodernism, says not only is everything made up, but it must be deconstructed. Okay, well, what are you building back in its place? Nothing. Nothing is the answer, because if you have to build something, you need a truth like gravity. So they're not building anything after they tear it down. Now, apply that same philosophy to individual psychotherapy or family psychotherapy. It doesn't matter. If all I'm doing is tearing down, poking holes in your construct, and I'm not building anything back up, what I've done is I've eroded your understanding of reality. Now, what if you come into my office with a shaken foundation, or you don't have one anyway? I have no tools and no empowerment to say, here, try this, try exercise, try religion, try eating better, try whatever, right? Pick a favorite song, go play the guitar, right? What I've done through the eyes of these postmodern deconstructionists, or i.e. woke, as a lot of people will say, is I am inserting myself into them. I am being imperialistic. I am being whatever I'm being, right? That is, or the offense of the day. So now imagine a bunch of grad students getting exposed to this, where nothing's real, everything's a construct of a construct. What must that do to the underpinnings of psychotherapy? Well, psychoanalytic theory goes out the window, because now, I mean, the idea of a soul is gone, because that's something that's, rooted and anchored in something bigger than you. Can't have that, because then we'd have a truth. So we're left with the behavioral therapies, the BTs. And not only are they useful insofar as supporting the postmodern deconstructionism, because it's like, I'm just correcting your behavior as you asked me to. Oh, but really I'm not, you are. And we stop there. We stop with your outward behavioral presentation, your smoking, your drinking, your anxiety, your bipolar disorder, whatever it is that we're saying. It's like, once we hit that, we're done, right? Well, no, I can pick another one and I can keep you on the calendar forever. Your smoking turns into drinking, your drinking turns into anxiety, your anxiety turns into depression, and I'm playing therapeutic whack-a-mole. Well, what's underneath that? You, who are you? What's your identity? Let's find that out. Well, that's not congruent with postmodern deconstructionism. If I'm trying to build you up from an anchored foundation, I have to assert some truth somewhere. I have to assert some reality somewhere. And if the students coming out of these programs are told that reality is subjective, then what are they supposed to do with somebody who walks through the door saying, I'm sick and I need your help? Other than say, well, all right, here I am to help you. Here's what I advise. Here's what I reflect. It seems to me that your blah, blah, blah is not working anymore. They've been totally neutered. They lack the ability to make basic reflections, by and large, for fear of offending the person, guessing wrong, stepping into some social doctrine that's unpalatable, and the list goes on and on and on and on. So they're basically paralyzed through anxiety of worrying about pushing people into some fear state or some despair that they can't control, and they will be accused of perpetrating harm. So that's what I'm saying. We've walked away from the profession that got hired to give honest feedback in order to benefit somebody, and we've morphed into something that simply pets the individual along the way and says, there, it'll be okay. And that's supposed to pass as good psychotherapy. And it's gross. I actually, just aside to this, one of my very good friends moved to Utah recently. He was our clinical director. We still talk all the time. He sent me a picture of the local Provo newspaper with an ad for a therapist in town, a therapy agency. And it says something like, if you're having trouble finding friends, try therapy. A therapist can be a great friend for you. It's like, no. Talk about no boundaries. Like, how are you supposed to teach boundaries if you don't have any? So that's what we're doing, though. From the BetterHelps and Talkspaces of the world that advertise with their gazillions of dollars on TV during NFL games, all the way down to local Provo paper, we've turned the profession of psychotherapy into a fun little thing that you do on the weekend or in the evening or something, where you just go and like talk. It's like, no, we're not. That's not what we do. That we could call that consultation, back to my original point, but it's not medical model therapy. come in with a symptom, we'll find the problem, treat the problem, and then your symptoms go away, and then you're off the calendar. I don't want you coming back through my door anymore. So we've lost that ability, it's very tiresome trying to deprogram these folks and push them into the right direction where we're actually putting our eyeballs on achieving some goal rather than just keeping them on the calendar because it's fun for everyone.
Yeah, I mean, there's a lot to unpack there. So one
Yes,
is kind of, yeah.
You wind me up and I tend to go.
Yeah. One is kind of the dumbing down of therapy. I mean, if you go back and read like Freud and Jung, it's like, let's dig deeply into the human psyche and the human soul and unpack this and pull this stuff out and kind of figure out what people are made of and what went wrong. And then in a scientific but more shallow way, you have the behaviorists who are like, let's just tinker with people's behaviors, and then CBT, thoughts and behaviors. So there's kind of becomes dumbed down in a lot of ways. But there's also what you call postmodern deconstruction. A cynical view of that is they're not really relativists at all. That they're actually, the relativism is kind of a rhetorical tactic covering up a political position. I'm wondering if you see like a political stance behind the postmodern deconstruction.
I'll take this in reverse order. If there's a political position, it's probably something akin to cultural Marxism. Marxism, as we know it, is economic distribution of wealth, right? And this is a cultural redistribution of whatever perceptions people have of your resources, we'll call them. I don't want to say money, but it's your power, your privilege, your whatever you've achieved in life. They want to tear that down and somehow disseminate it, I don't know, like through osmosis or something. So if there's a political position, it's that. But I don't think there is one because by definition, postmodernism can't take a stand on anything. So there is no thing that they're trying to achieve, because if you achieve it, then you've achieved something, and therefore they could claim victory, and then it would be over. But it won't be over because there's always something else to be done, to be deconstructed, some system to be taken down or torn apart, or some faceless object at which we throw eggs, right? So I don't think it's political at all. I think it's ideological, and I think it's culturally narcissistic, where we've created a class of people who happen to have largely graduate degrees, sometimes not, but they're out for power and control over others because they can't control themselves. And so as I'm working back through this, what happened with the legends of the field, the Adlers, the Freuds, the Jungs, the Freud's a little out there, so maybe not him, but the people who have well thought these things, Joseph Campbell, David Hawkins, he's a little weird too, but the concepts are good, right? There's a depth of human psyche, and psyche, for the listening audience who you don't know, it's Greek. Psyche was said to be the goddess of the human soul. So psyche, soul, mind, we use them interchangeably, although we could have a debate about what is what. The idea is that humans are deeper than their outward behaviors. There's more to you than you realize. And I think the reason we don't do that work anymore is because it's hard, and we're just taught to be lazy and cherry pick intervention strategies and throw them at people. And that passes for good work. So there's that. We're in a culture of instant gratification driven by everything. Probably started with the microwave oven, I don't know, back in the 50s or something. And then it went to the VCR where you could like pause, record things and skip commercials. And now it's accelerated to, drone delivery of your groceries or whatever it is. And so we have no patience. We don't have any distress tolerance. And therefore, we're not going to be patient and tolerate distress in the therapy office either. It's just much, much easier to deal with what's observable. And by the way, it's funded. If I can tell you that you now smoke fewer cigarettes per day over 6 months versus the previous 6 months, and I've captured that in a year, and then I followed you for 6 more months for a total of 18, I can claim victory over your cigarette habit. Now you pay me because I've provided evidence, and here's where we get the evidence-based practices, right? So there's a lot of incentives built into this new structure. There's the financial motivation to produce results. There's the instant gratification of our culture. There's the lack of willingness to go deep into one's own psyche. But the reason behind not wanting to go deep and do the hard work is because it would require me knowing who I am relative to the person across from me such that I could guide them there. And if I've been told over years of graduate school and then years of internship and then years of professional counseling, we'll say I'm like 5 or 6 years into the field now, and all I've heard is nothing is real, don't be a jerk and tell people what's up. Don't try to force your truth into somebody else's life. Well, I'm not going to be willing to go explore somebody else's psyche to the depths that are required to uproot the problem. It's way more easy just to treat the symptoms. And for anybody who's curious, an unorthodox opinion is that I happen to think that everything in the DSM is a symptom. I think the problems are things that don't have codes attached to them that give rise to the symptoms. And so that would be things like self-efficacy, trauma history, not knowing where one is going in life, lack of emotional understanding or tolerance or education, things that don't have codes, right? And if I have those things, there's only a handful of them. There's not too many problems with a human. There's lots of symptoms, lots of ways it manifests. So if I'm not confident in myself, I could bounce into narcissistic personality disorder, or I could drink too much, or I could do methamphetamine to, amp myself up to make myself feel better, like I can accomplish a bunch of stuff, or I could take, psychotropic medication to dull the whatever's going on, or I could slip into psychosis because I can create my alternate reality. If I don't believe that I'm confident enough to handle my own reality, I can just create one. I can slip into depression. Like, there's lots of ways that my lack of self-efficacy can manifest in a symptom that's codable that I could send off to insurance. It works really well for the BTs. If I do DBT and fix your borderline personality disorder, something that's workable so you're functional in society, I get to self-congratulate, right? But did I tackle the why you even had borderline in the first place? Did I ever talk about your trauma history? And this is where affirming care goes off the rails. And, it starts with gender affirming because that's on everybody's minds. Somebody comes in and they're gender dysphoric, right? They don't know if they're a boy or a girl or a cat or a dog. And we're supposed to, as commanded by the AAMFT and its 26 pages of guidance, just agree with them. Like, I'm supposed to agree with your dysfunction? That doesn't even make sense. Like, what am I agreeing with? You came in ailing, allegedly hiring to seek my help. In what other profession would the professional ever go, yep, you know what? You don't need my help. Well, why are you in my office then? Like, would an attorney do that? No, a doctor wouldn't do that. A dentist wouldn't do. Like, imagine rolling into the dentist's office being like, hey, doc, I need you to pull this tooth here. Doc's like, actually, I need to pull the other tooth. Like, no. You're not affirming me. That would never happen. But we're under that constant threat, and it's all the time. If we don't affirm somebody, we've caused harm, nay, abuse, right? That's the problem where we find ourselves. So I think it's a confluence of laziness and lethargy, lack of intellectual curiosity, lack of knowing who we are such that we can guide somebody else through their stuff, lack of distress tolerance, desire for instant gratification, and money.
So you just tackled several sacred cows there that I'm going to try to unpack. So one was evidence-based medicine is kind of a scam. It doesn't really mean what you think it means. The DSM is just symptoms. It's not actually underlying problems. And gender-affirming care is not good psychotherapy. Unethical, yeah.
Malpractice. I would take it so far as to say it's malpractice.
As far as I know, it was considered like a disorder in the DSM-4. And by the DSM-5, that was changed. Do you know what? Because, from what I can tell, there wasn't any new psychological or medical evidence that caused that change.
You glitched there for a second. Which one are we talking about?
Sorry. In terms of gender dysphoria, it was removed in terms of a disorder. It's not. Sorry,
it's still in here.
Gender dysphoria is, but identifying as the opposite sex is no longer considered a disorder. Correct?
Yeah. You're talking about transvestism.
I think it was the difference between the DSM-4 and the DSM.
Yeah, I think you mean transvestism because it's not in there anymore. It's just gender dysphoria. I don't know, other than the gender activists got a hold of it because in the DSM it also says assigned gender at birth, which is nonsensical. They've totally upended biology and they've done away with the sex binary. In here. So it's like, okay, fine. You want to define gender as how you perceive yourself in contrast or comparison to sexual norms of the culture. Fine. I'm fine with that. We've had people do that for millennia. Okay. Now, where does it become a disorder? And they give a whole set of criteria, right? If you hit the criteria, you therefore qualify for gender dysphoria. All right. It's a symptom. I want to know the why. I want to treat the problem. Why do you have gender dysphoria? I'm not going to sit there and pretend that your gender dysphoria can't be cured. That would be nonsensical because it's a disorder. Now, if they take it out and just say it's not a disorder anymore, all right, that's a different discussion. But so far it is, and it's still a disorder, meaning it's something to be fixed. It's wrong, right? All right, now we get into a debate about how to fix it. Now, the gender activists will say, well, you affirm to send them down a path of medicalization, make their body match their mind. Now, that's a complete inversion of everything that we've done in psychotherapy for 100 years. What we used to teach is your mind will come up with lots of things to make the environment make sense. That's how we get our disorders, when we irrationally think things that aren't there. It's delusional, it's psychotic, it's whatever it is. So what we traditionally have done and historically is we said, let's help your mind match the environment. So if it's hot outside and you're denying that it's hot and you're saying I'm freezing, we'll just educate you on what heat versus cold is. If your body is hungry and you're grouchy and irritable and you think you have a bad attitude, and this happens frequently because you're not eating properly, I'll say, well, eat properly, and then we can make the physiology make sense. And oh, by the way, let's tend to your anger impulses so we can make the mind match the body and move forward. Now we're making the body match the mind. And this obviously has lots of memes and punchlines associated with it. It's like my kid is 4 years old and he thinks he's Spider-Man. Let's go get the surgery, right? But that's not a tongue-in-cheek comment. That's very, very real, because we're doing it with chopping off healthy body parts of children, and then we're putting it into law. And I would push back and say, where on God's green earth would we ever think that the most extreme form of intervention strategy is the first line of attack? That's never been a thing. And in my Nevada State Medicaid Services Manual, it literally says you try the least intrusive method first, and failing that, then we level up. Medicaid won't even pay for intensive outpatient if you haven't at least tried straight outpatient and failed at it. And that takes many months. So therapy first. Let's talk through this. Let's address your potential autistic issues and your inability to read social cues. Let's address your trauma history that led you to think that you're not safe in your own body or whatever it is. Let's address the spiritual aspect. What's your spirituality say about, who has a creation walking the earth? Why we would ever leap to butchery and lifelong chemical addiction is beyond me. It's cruel, it's inhumane, it's malpractice, it's demonic, it's all sorts of things that aren't psychotherapy. So that's why I don't like affirming care, because the next step of affirming care, and this has already rippled into many facets, is a parent walks in with a child and says, he has ADHD. Well, hold on a second. I'm the one who possesses the license from the state for diagnosing. I will do the diagnosing. But you didn't affirm me. I walked into your office and I told you what's going on. You need to affirm me. No, that's not how this works. Go, there's the door. I'm not going to do that. Go find somebody else who's going to participate in your delusion. Because what I'm going to say is, it's your parenting issue. You're too diffuse with your boundaries, and that's why your kid bounces off the walls, because you've never held any structure for him. No, he has ADHD. Fix his ADHD. No, I'm not treating kids in a vacuum. We don't do fix my kid here. Actually, my intake paperwork says that. It doesn't say that in so many words, but it says you parents as the executives of your home are responsible for the system in which you operate, and as go you, so go your children. You're required to attend sessions. We're not going to treat your kid in a vacuum. So we don't do that, and we shouldn't. That's my take on the DSM. But yeah, go ahead. The BTs, by the way, they're convenient, I think, because like I said, if I can establish that I've done something, then I can document that in the chart. I can believe I achieved something. And if I can put in the chart that I referred to surgery, then I've moved on or whatever. I've checked the box.
It seems like this is some kind of weird combination between cultural Marxism and the capitalist idea of customer's always right, and combining those two in the worst possible way.
Yeah, probably. And our own insecurities as clinicians, our inability to watch people in distress probably is a big part of it. Everybody's had this experience probably where you're conducting a group therapy session, and in that setting, the energy is such that you're inevitably going to pick up on whatever somebody's feeling. The person becomes tearful while telling a story, and almost immediately the hand comes out on the thigh, and somebody reaches for the Kleenex box. And it's less about assuaging that person's difficulties and more about me wanting to pull you out of it. I don't want to see you in distress. Gentle parenting, quote unquote, also has that flavor where I don't want to see my kid in distress, so I'm going to just give him jelly beans to make him shut up. It's like, well, no, what you need to do is teach him to tolerate the distress. And I think on the whole, practitioners don't know how to tolerate our own distress, and therefore we can't tolerate other people in distress. Therefore, we're not going to push them into distress by challenging their worldviews or their belief systems. that are the very thing that brought them into counseling in the first place. It's like your irrational belief system about why methamphetamine is good for you is causing your job loss and your jail time. If I don't know how to challenge that belief system appropriately and compassionately but firmly, I'm not helping the person. I am, in fact, harming them. And that's what affirming care does. It just says, well, it's up to him to decide what he wants. And now we've got the harm reduction model, which is also malpractice and possibly the biggest grift going right now, because you're not trying to get them better. What you're trying to do is not make them worse. So it's like, so as long as they're not injecting themselves with dirty needles, it's okay for them to stay addicted. What? On what planet is that acceptable for taxpayer dollars to fund, by the way? No. It's bizarre.
So, I mean, there was a couple things. There was the WPATH files, the leaked documents from the big transgender organization WPATH, and then there was the CAS report coming out of the UK. And both of those seem extremely damning for transgender medicine, especially for minors. And it seems like there was just kind of a shrug by a lot of ideologues in the profession, like almost not willing to acknowledge that. And you talked about people who would refuse is actually not good for you. And both of these things seem to be linked to this hijacked form of empathy, this kind of twisted form of empathy that's willing to give you something even if it's bad for you so that it can kind of calm you down and don't upset you.
The weaponization of empathy is a big problem, but you touched on it earlier about the ideologues. An ideologue is someone who cannot separate what he believes from who he is. So if I can't separate what I believe from who I am, attack on the belief is tantamount to attack on self. So I will get a very limbic response to that. I would be very defensive when you attack my ideas or challenge them or even question them, because I can't defend them because they're not my own. It's just something that I've interwoven into my sense of self. So if I believe that the San Francisco Giants are the best team on the planet and I can't separate that thought from who I am, and you say, well, the Giants aren't very good this year, I'm going to feel personally attacked. And I say feel because it's a very defensive, evoking feeling of fear that I'm going to experience when you challenge the San Francisco Giants. Now, if our profession has been steeped in ideological belief through grad school, and they are, like, this is not even up for debate. And I'm not even talking about the gender stuff. I'm talking about social workers are better than MFTs. MFTs are better than counselors. Counselors are better than whatever, right? That is an introjected belief. We're talking about Jungian analytic psychology, right? An introject is an unquestioned belief or assumption about the way the world works. Students are absolutely introjected to believe that cognitive behavioral therapy is good, psychoanalysis is not good, right? Insurance has reinforced this by saying we're not paying for psychoanalysis. Well, how do you even know what I'm doing? You're not looking behind my wall when I'm in session. I could be doing psychoanalysis. I could be doing CBT. You don't know. I'm not documenting that. You're doing REBT or choice theory. But we're definitely absolutely taught ideological positions. Now, take that into other realms like affirming care or whatever. We churn out these ideologues who are taught what to think, not how to think. That's a problem. Now you get something like the CAS report that's published and says, hey, what you think is probably not true. The ideologue will bristle at that, become very defensive. Or, like you said, they just shrug. They go, no, I don't have to pay attention to that because it's not what I believe. And what I believe is true, and I'm just not interested in changing my mind, which is very paradoxically ironic for a profession that allegedly hangs its hat on lifelong learning and non-judgmentalism, because we're not doing either of those things. We're being very judgy, and we're being very rigid when we reject evidence that is overwhelmingly in opposition to what we've been taught. And, oh, by the way, the WPATH files essentially revealed that the whole thing was contrived anyway to make money for a very small set of people who are, well, let's just say they don't have the best interests of humanity in their minds. And then it gets adopted into law. And so if I'm a licensee and I point to the law and I say, well, it's in the law. Like, well, yeah, a lot of things were in the law historically and they weren't right. They were very not good, in fact. And that's why we had civil rights revolutions. So just because something has been embedded into law, like Nevada did in 2023, when we compelled insurance companies to pay for quote unquote gender affirming care for children, I don't know that I can hang my hat on making sure that that's the right thing to do. So what I try to do is push back and go, are you sure? Is this really what you believe? Or is this like something you should change your mind around? Is this the best thing? Now compare that to your ethics. And of course, as you know, a lot of these people just warp and twist ethics to match their ideological beliefs, which is the weaponization of empathy also. They go, well, what are our 5 ethical precepts? Fidelity, justice, non-maleficence, beneficence, and autonomy. And so I can make an argument that says that surgery for children to make their body parts match what their feelings are on the inside, their subjective feelings, we're going to permanently alter their exterior appearance, is harmful. It violates their autonomy. It is not beneficial, although maybe I could say it benefits them if I truly believe that they know what they're talking about, but they don't when they're 12, because we have, 90 years worth of developmental psychology and biology supporting that. It's not faithful. There is no fidelity to what they entered in to do. And I'm not sure that we're doing justice. Flip that around and I can make the same exact argument, but the opposite direction. It is beneficial. It would be harmful if I didn't do it. It is doing the right thing, i.e. justice for the child, because they need me to advocate for them. I absolutely respect their autonomy because they are expressing to me what their deepest desires are, and it is upholding the ethics. So who wins there when we have an ethical debate in 2 completely divergent directions? So this is how the narcissists in our industry and the sociopaths can get away with pushing the agendas and the ideologies that they have, is because they can take the same exact 5 ethical precepts, warp them into a weaponization of empathy, and drive policy from it. And all they got to do is shout louder and cite very poor studies, very poorly done, cherry-picked research, but it's published, right? So as long as it's published, there's our standard, while those same publishing houses suppress publication of alternate viewpoints. So it's very, very sinister. It's very pernicious what's going on. And I think our job is just individually to keep having conversations where we go, oh, maybe, okay, but I'm not going to do it. And where I say is I'm not writing you a letter to go to the doctor to chop your kid's healthy body parts off, because I'm not a medical professional, just the same as I wouldn't recommend a kidney transplant. I don't know. I'm not an endocrinologist. I don't know. My lane is right here, talk therapy. If you want talk therapy, I will provide talk therapy. And the fact that we have been dragged into this fight, I think, is despicable, because it's a buck passing from the medical community onto the therapeutic community to say, hey, certify that this person's okay to have this surgery. Right, elbow in ribs. You better. And if you don't affirm, you're going to be a bigot, and we're going to charge you with something at your licensing board level.
It seems like, the standard for evidence is completely different if you declare it to be a human rights issue. You say, this is social justice. This is going to put us on the right side of history. Therefore, the strength of these studies is not really fully relevant.
Well, we see it you mentioned, we haven't talked about it yet, but we see it in the firearms community too. So in our realm, guns are not discussed. And if they are, they're looked askance upon and they're evil. And by extension, the people who own them are also looked askance upon and evil. Well, as a firearms owning, concealed carrying therapist, I walk in both territories, and that's mind bending to some people. Firearm ownership is a human right. It's a basic civil right. The right to self-defense is not given by anyone. It is inherent to walking the planet, and it is protected by the Constitution of the United States of America in the Second Amendment of the Bill of Rights, just like freedom of speech. You cannot control my speech. You can control the consequences to my speech, but you can't control my speech. So therefore, our government back in the day said, we're going to protect this so nobody can infringe on it. Well, in the therapy community, if I advocate for a quote unquote human right, like the right to be left alone in my psychosis, well, what does that do to the objective criteria in the ICD or the DSM? I don't know. Like, does the doctor stop advising treatment for cancer because the patient says, I'm scared of what you're going to do to me with your little surgical knife to take the tumor out? Or does the doctor have a moral, ethical, and legal obligation to recommend care? Because we're not even recommending care at this point. We're not even recommending things. We're saying, yeah, whatever you want, man. You want pills, we'll give you pills. I think we're dangerously teetering on something that threatens to upend and invert all of the professional capacities that we all possess. I mean, let's take it out of the healthcare realm and put it into contractors. You want a bridge built, and the person who wants the bridge built goes to the contractor and the engineer and the designer and says, I want it made out of balsa wood so I can drive my car over it. They're going to be like, well, no, because that's not industry standard, and balsa wood isn't going to hold your car up. We need steel and concrete. No, 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 no. Well, now we've inverted the power dynamic, right? You've got the customer saying, what is right. It's like, no, I want balsa wood. The engineer goes, I'm not designing something out of balsa. I can't. It's not possible. By the way, we're in Nevada. We live in an earthquake zone, right? And the contractor's like, no, I'm not signing off on that. That's dangerous. People are going to drive. First car drives over is going to crash. Now imagine that customer has a whole cadre of people behind him or her. And that cadre of people has lobbied successfully in the legislature to compel the construction companies to build whatever they want out of the materials of their choosing. That's where we are in healthcare. It's like, who's going to sign on for that? I certainly wouldn't. And I have no protection liability-wise from the impending lawsuit. And that's what's happening with the detransitioners. Detransitioners are coming out going, somebody should have told me. Somebody should have told me and stopped me along the way before I went this route. Now my life is ruined, my body is ruined, my chemistry is imbalanced, my endocrinology is all out of whack. Who's to blame here? Was it the therapist who just blindly shuffled me into the clinic, or was it the clinic doctor, medical director? And those detransitioners, those poor people, they're just getting run roughshod over. They're getting called names, and they're getting silenced, and that's what's happening. This is the guy who wants the bridge built out of balsa wood, completely inverting the entire power dynamic. It's like, if I have a license to practice and I'm not allowed to practice within that scope as I see fit, then why do we even have licensing? If you're just going to neuter me at the entrance, it doesn't make any sense. But that's what we're looking at.
Yeah, so you brought up firearms, and you have a podcast devoted to firearms and mental health. Tell me what you see at the intersection of those two.
Oh man. So, a lot of, I hate that the word misinformation has been weaponized also, but there's a lot of misinformation. Gun control organizations have well-funded lots of studies to support their ends. And that comes from the Bloombergs of the world and lots of people, the Moms Demand Action and so forth. And so what they do is they fund studies that do linkages that are basically common sense. Like, well, in this area of the country, we have higher firearm prevalence, and therefore we have higher firearm suicide prevalence. Therefore, higher prevalence of firearms equals higher suicides. Therefore, we should probably try to restrict the firearm access. I'm fine with that. That's true. It's like saying, there's more pools in Los Angeles than there are in Reno. Therefore, there's more drownings. We should restrict access to pools. Well, okay, we could debate how we do about that. We could do education. We could do fencing. We could do all sorts of things, right? What's missing, though, is that in the enactment of these policies that ostensibly are to protect public welfare, and so far as like red flag laws, where if you're struggling, the deputies can come and take your guns for a temporary time, so long as it takes you to get well, or mandatory background checks, or any of that stuff, right? There's a deleterious unintended consequence, and the effect is that people don't want to come into counseling for fear of losing their gun rights. So they don't come into counseling, they ostensibly get worse. What does worse look like? Marriages failing, children being abused and yelled at, jobs being lost, addiction, and suicide. So I'm part of an organization called Walk the Talk America. Walk the Talk America is a 501c3 endeavoring to bridge the gap between firearms ownership and mental health care to get gun owners access to counseling services without the fear of rights restriction. And the reason that's important is because we're a suicide prevention organization at our core. Now, if you look at the pie chart distribution of gun deaths in America, on the whole, nationally, about 60% of all gun deaths are suicides. So that'll vary by geographic region. So if you're in Wisconsin or Wyoming, that number spikes considerably. It goes from 60 to about 70, 75, almost 80% in some places. And if you get down to the county level, sometimes it's 100% because there's one gun death in some rural county in Wisconsin and it was a suicide. But on the whole, nationally, you'll see it fluctuate from year to year. Somewhere between 58 and 62% is suicides. Of all gun deaths are suicides. About 30%, 31% are homicides, and then the rest are negligent or law enforcement caused, whatnot. So if you really want to move the needle on gun deaths, and negative consequences of firearms ownership, you really need to hit suicides. And how do you hit suicides other than mental health care? So we're trying to push some positive messaging that says it's okay to talk about being not okay mentally. In fact, it's part of the preparation culture in firearms ownership. The firearms culture is very, very, very diverse, very diverse. It's not just bearded white guy in his 50s wearing camo pants shooting at geese in the, in the plain states. It's your mom in Compton who's, single and has 3 kids and wants to protect herself. It's your trap shooting youth. It's your hunters and outdoorsmen. It's your law enforcement. It's your military veterans, service members, and their families. It's a wide variety of people of all political and demographic stripes. In fact, there's 2 clubs, the Liberal Gun Owners and the Liberal Gun Club, that most people would think, well, liberals don't own guns. Yeah, they absolutely do, and they're the fastest growing demographic. So are Black people and women. So gun community is very, very diverse. What Walk the Talk America offers for the layperson, but specifically the mental and medical practitioners, is a cultural competence courses. There's a 3-part series, the first 2 of which are available for free on our website, WTTA.org, walkthetalkamerica.org. So we start there. We also offer free and anonymous mental health screenings. That's a polite, arm's length, non-intrusive way for the firearms owners to just check in on themselves. Everybody likes free, and gun owners like anonymity. So free and anonymous mental health screenings, great way to check in on yourself and see if you need professional psychotherapy or just to take a break or whatever. There are like 14 of them. A couple of them are in Spanish. We also train the firearms community, and we try to demystify what counseling is so that they're less skittish and afraid to come in. Well, flying in the face of all this are some policies that as a 501c3 we can't get involved in too much, but we can educate and we can help people become aware of it. And Mike Sedini, who's the founder, who's a 3rd-generation firearms industry person, he has gone around to lots of these symposiums and discussion forums and whatnot, and he's presented from the firearms community's angle something other than pride for my cold dead hands. And he says, what you guys ought to understand is that through policies like red flag laws, that in some states like Colorado and New York, where they empower practitioners like you and me and our brethren to enact and effectuate a petition to a judge to take firearms away from an individual who's in a mental health crisis or is a threat to harm himself or others with those guns, it keeps people away from care. And we don't have any of those studies. Bloomberg isn't funding any studies to find out how this negatively impacts suicide rates or mental health concerns. They're only funding the studies that show how often a gun is taken and whether or not it's actually keeping people from death. We don't see the null, though, which is the people who don't come into care because they're afraid of what may befall them. If you think about somebody like a domestic violence survivor who purchases a gun for herself because she's still afraid of her ex, because we all know that people don't respect the paper on which the protection order is written. If she is in counseling and she says that she's, in a bad way, and the counselor isn't competent enough to have a conversation about her gun ownership and maybe what she can do in the temporary time that she's changing medications or whatever, maybe that person pulls the lever, the deputies come knock on her door, they take the gun, and now she's defenseless against the ex who perpetrated the original violence. We don't want to be doing that to people. We don't want to be pushing people away from care. So that's the whole mission of Walk the Talk America, is to educate and elevate. We want alternatives to the government stepping in and taking our property away from us. Debates about due process aside, we're trying to figure out ways that we can do that voluntarily. So through gun shop programs, gun shops will often take in firearms in a time of need, no questions asked. Neighbors, if you're in a state that doesn't require background checks for transferring firearms, you can just hand them off to your neighbor. If you are in a state that requires background checks like Nevada, you could take a non-serialized operable part from the gun, like a bolt or the bolt carrier group or the firing pin, and just stick it in a bag and hand it to your. That's what we're trying to do. And the podcast, as you mentioned, is called Guns and Mental Health. It's available wherever podcasts are found. You just search Guns and Mental Health. And we interview people about these topics, about the suicides that they've experienced, the suicide loss survivors, the mental health struggles that get people in the gun community deal with. We talk about the nexus of things like cannabis being legalized, quote unquote, how it helps people and they still want to own their guns, but federally that's a conflict. We talk Owen Galp doing psychedelic medicine research. We have lots of wonderful conversations about this topic, and we have a handful of practitioners who contribute from time to time on the podcast talking about things of the therapeutic nature. And we also have a or Second Amendment 2A friendly provider directory that we're trying to grow nationally so that if you are in a tough spot and you need a therapist, you can get one who you know is going to not judge you immediately for your gun ownership. And my unique story is that I've experienced that myself. I've been in those rooms, in those board meetings, in the community groups where somebody's just talking negatively about guns, disparaging gun ownership. And I'm sitting there, I'm like, I'm right here, right? Wait, no, you don't, because I'm closeted. You don't know that because I haven't told you, because I don't want to tell you because you're going to not like me for this natural civil right that I'm choosing to exercise and which is protected by our Constitution. So therapists have to change their minds about that too. We got to get out of the state of mentality that we know everything about everyone all the time and draw judgments accordingly. It's not good. Some stats real quick. Nationally, about 1 out of every 2 people either own a gun or live with one. Locally, wherever you are, that can go up or down. If you're in a big city where there's not a lot of reason to own firearms and maybe the policies don't prevent you from doing so, like San Francisco or New York, it'll be lower. But certainly in rural areas, and if you're in my area, Northern Nevada, it's probably more like 7 or 8 out of 10. But on average, you can reasonably guarantee that 1 out of every 2 people that's going to walk through your door either owns a gun or lives with one. And you can't afford to be ignorant about this topic, especially when suicides are so high and continuing to climb.
Yeah, you thank you for that. You got a lot of stats and facts on your side, and I really appreciate that. We talked earlier about ideology and how ideologues hold on to something because they've got an emotional attachment to the idea as part of their identity. I'm wondering if you see that as part of the gun debate. And one thing I'm thinking of is, one thing we keep hearing, that comes up in the media cycle over and over is we have to ban the big scary guns, and a tiny percentage of gun deaths come from like the AR-15 or any of those, the big scary one. But, I'm wondering is it difficult for you to, engage in such an emotionally loaded debate?
Not really, because it's really easy to pluck the Jenga bricks out of that tower, so to speak. We start with what Mike Sedini, I already mentioned him before, founder of the organization. He espouses this very strongly, and so do I. Don't come with a criticism unless you have a solution to offer. I don't even care if it's a silly solution, but start with a solution. So some of these are preconceived solutions like ban the guns. Okay, well, if we're banning all guns, I'm not really attached to that. You want to ban all guns and wave a magic wand and make them all disappear. Cool. All right. I'm not going to die on that hill. Not going to happen though. So that's not reality. So we're not going to live there. That's a non-starter. So let's meet the problem where it is, which is 300 and something million guns, which is more than people we have in this country. What do we do now? We meet the issue where it is. So some people will say, all right, magazine capacity restrictions. All right, well, I'm in the suicide prevention realm. So how many bullets does it take to end a life? You're gonna ban what? Anything over 1? I'm not interested in having the conversation about 30 is too many. I can also make an argument that 30 is plenty for fending off multiple intruders in a home invasion or in a mass shooting with multiple assailants. So then you go, all right, well, what about mass shootings? Well, okay, mass shootings are, as Dr. Jeffrey Swanson from Duke University once said, it's like trying to find a needle in a haystack. They are so statistically infinitesimally small, they're irrelevant. Now, I know that perks people's ears and is like, well, you said mass shootings are irrelevant. No, I said they're statistically irrelevant, and there's a big difference there. So statistical irrelevance is on that pie chart that I mentioned, 60% are suicides, 30% are, homicides. Well, what are the mass shootings? 0.3% on average. They're less than 1% of all gun deaths. But they're sensationalized because they're scary and you never know when one is going to happen. And that's very scary. And the media love dragging those out. And it's not because the media are necessarily pernicious in their approach, although some may be, or that may be accused of being. It's that it sells clicks. Media is driven by advertising. Advertising requires eyeballs. So the more eyeballs you can get, the more advertising dollars you can get. And the way you get eyeballs is stimulating the limbic system, chiefly through fear or excitement. So if I'm excited about the new iPhone, I'm going to go put eyeballs on it. If I'm scared that I'm going to get shot or my kid's going to get shot at school, I'm going to pay attention to that thing. So
It's
that's
also
their
one of those.
incentive.
It's also one of those cognitive biases, like how people assume that airplane crashes kill more people than car crashes. Well,
Yeah,
that's
no,
what you remember in the news.
right. Yeah, air travel is the safest travel we have, right? So,
Yeah.
but we don't let our frontal lobe drive our decision making. Oftentimes, we let our limbic system do it. And I have a whole emotional functioning series on this, and it's why it's important to know our 10 core emotions and act with reason, not emotion. So anyway, we say, all right, well, what's your solution? We say, well, we're going to stop mass shootings by banning the air. All right, well, logically, that doesn't make any sense. There's 25 million AR-15s in the country, and you're not going to control them all. But what is it about the AR-15 that you don't like? Or what do you think will impact the mass shooting? We'll just
scary.
focus. We'll pretend that, right. We'll pretend that statistical irrelevance is something we can control. How do you control it? I don't like that it shoots a bunch of bullets. Well, it only shoots one bullet at a time every time you pull the trigger. Okay. Well, now we're talking all semi-automatic weapons. So handguns, shotguns. And it's like, well, okay, now you're talking about banning all guns again. Unless you're talking like the old-fashioned bolt-action rifles. And if you're talking about lethality, because people say, oh, the AR-15 shoots the .223 round and it destroys flesh and all this stuff. It's like, well, if you're talking lethality, it's actually not that. You want to ban the 30-06s and the 300, the 300 Blackout and the 6.5 Creedmoors and all the bigger rounds. We don't want to attack the .223. So at every turn, we can have that debate about what's reasonable, and it always comes down to education and personal responsibility. If we talk about banning certain things, you could say, well, people are going to get around the law anyway because all you're doing is keeping the honest people honest. So I'm a bigger fan of education over restriction. I think restriction is a never-ending treadmill of chasing things that you're just never going to achieve. So from there, I go back to let's have a reasonable conversation about what we want to achieve. And we go back to the medical model of what people do when they walk into counseling, for example. What's the problem? The problem is too many gun deaths. Cool. Let's talk suicides, because that's the biggest percentage of all the gun deaths. All right, what's the problem? Too many suicides. All right, what's the goal? Reduce suicides. Well, by how many? Now we have to quantify it. So I don't want to throw out the evidence-based practice that we crap on all the time. It's like, it's not for nothing. We need quantifiable metrics. We need reasonable articulable goals. We need time limitations on this. So how many suicides is enough? Well, now we're debating death. How much death is acceptable? Nobody's going to say that some death is acceptable. So they say zero is not a goal. Zero cannot be the goal. It's not even reasonable, let alone possible. So, then we get these programs like zero suicide. Zero suicide is not a reasonable goal. Stop saying that. Stop putting artificial, unattainable goals in people's consciousness. It's not good for anyone. Because then every time you have a suicide, you think you're a failure. Now it becomes binary. It's like, well, we didn't get zero suicides, therefore we failed. It's like, well, no, but you went from 39,000 firearm suicides a year to 20,000. I'd say that's a success if we educate people, if we get them the mental health help they need. And that goes to something else that's a sacred cow in our field, which is I want to work myself out of a job. So I give away a lot of stuff for free. Podcasts, YouTube videos. I want everybody to learn emotional functioning. If they learn emotional functioning and know it well and can articulate it and validate it in other people, maybe you stop coming through my damn door. I'm fine if everybody heals and there's no suicides and there's no divorces and there's no kids getting bullied on the playground and I have to close up shop, but I still got 8 years left on my lease. I'll turn it into a brew pub and coffee shop. I'm not attached to this. My self is not identified as therapist. That's not who I am. It's just something I do to help Earth get better. So I'm trying to work myself out of a job, but that threatens the whole structure. It threatens the whole enterprise if everybody gets well, but I want everybody well. And I want you to be well. I'm not going to delude myself into thinking that government can pass a safe law to restrict child access and that's somehow going to make everybody better. No, I want to hit the problem of why you were irresponsible in the first place. Why did you think it was okay to store a loaded, chambered handgun within child reaching distance? That's not good. And I'm not going to send you to jail over it because now I've just broken up your family and sent your children into foster care. Like what? That doesn't make any sense. We just created more work for the social workers? No. No. Education. If we're going to do some policy of some sort and we're going to use taxpayer dollars, we might as well use them to buy locking mechanisms for everybody, right? But compelling people into doing behaviors that we think they should be doing is not a good business. It is good for business, I suppose, because you draw down grant money. But That's not where I want to go. I want to go somewhere where we're encouraging autonomy and liberty based on good information and allowing people to make proper decisions. That's where we should spend our efforts. And if this thing, like the Surgeon General came out and said, gun violence is a public health crisis, and I reject the phrase gun violence, by the way. I think that guns cannot be violent. They're an inanimate object. That's no such different than microphone violence. Like, I'm going to hit you over the head with this thing. It's like, it's not me, it was the microphone. Let's sue the manufacturer. But if it's truly a public health issue, then we should do what we do with every other public health matter, which is educate. We educate everybody about smoking. We educate everybody about osteoporosis. We educate everybody about eating too much sugar. It's education first. We don't start banning butter because we think butter is bad. Like, no, we go teach everybody. But that's not happening. So for whatever reason, this gun thing it's been ideologically driven, and we've lost a lot of reason. But there are hopeful signs emerging from people in the research community who, when they talk to people like me and Mike, go, I had no idea. I had no idea that these data that are being used to create policies could be having a deleterious effect on the very thing we're trying to solve, which is quite cool. There are inroads, and there's reason for optimism.
Nice. Jake, we've covered some very fascinating topics throughout the last hour or so. I have one question left, and you can either answer specifically or in terms of public discourse. What is one issue that we're not talking about that you think we should be talking about?
I think we're not talking about the over-pathologization of normal human existence, and specifically childhood. I think we are way, way, way too quick to label things as maladaptive when really they're just normal development. The explosion of ADHD diagnoses and the subsequent medication thereof, I think, is despicable, and I think it's unnecessary, and I think kids need to be allowed to be kids. I think you have a lot of kids being completely failed by the educational system that is largely boring them to pieces, and so of course they're going to act out. We're taking away recess, for example. We're shortening recess. We're shortening lunch breaks. We've stuck them all on devices. And Jonathan Haidt has done a tremendous work on this. I'm not going to get too into that, but for people who want to learn more about Jonathan Haidt, it's HAIDT. Go to afterbabel.com, BABEL. You can see all his publications and research there. Jean Twenge, who's a colleague, she's got a generationtechblog.com. Go there and learn more about this stuff. But we're learning that the digital explosion in K-12 education is harming children. It's not even debatable anymore. Now, the educational technology companies will debate it, of course, because they have a stake and they stand to lose money. But it's a problem. So we're not talking about the over-pathologization of normal life experience. Every time somebody suffers a loss, it's like straight to the therapist's office. Like, no. You need to deal with this. You need to face it. You need to not isolate and bail yourself out of your emotional functioning. Again, watch my emotional function videos at the Zephyr Wellness website. Tolerate, endure, bounce back, grow, right? Like, don't avoid reality or escape it by labeling something as pathological and needing psychotherapy. Just because grandma dies does not mean you need to go to the counselor. If you watch grandma get hit by a bus, yeah, but only after waiting about 6 to 8 weeks. I want to see how you respond first. It's quite possible that your 6-year-old just moves on with life. Or it's quite possible they get stuck in PTSD symptoms, right? Then, okay, go to the therapist. But I'm not interested in talking to you about your anxiety over the job interview. Not interested. Go deal with it. Go do your job interview, and then teach yourself something. Grow. Stay out of my office. I'll treat the sick, not the well who are slightly uncomfortable because Amazon screwed up their delivery. I don't want to do that. I probably sound like a screaming
that's a good
man
answer.
Waving his fist at the clouds.
I can understand how you'd feel that way, but I feel like a lot of people, particularly people who are not in positions of power, feel that way. There's a lot of people with licenses and degrees that are driving the, everything needs therapy, and there's not enough people saying, like, a lot of this is normal life.
It's good for the ego. It's good for business.
Yeah, very true.
And I just go the other direction. I don't really care who thinks that that's not good. I'll let the market decide.
Awesome.
So,
well, Jake,
if
you'll hang around for just a minute as we finish uploading, I really enjoyed this conversation. Thank you for joining me.
Yeah, thanks for having me. See you on X, I guess.
All right, I'll see you there.